Hello, hello, good evening, everybody. Welcome back to our show. Oh man, I am so happy to be here today. Oh, it's Monday, the almost the end of the month. Wow, just a few more days, and then we're heading into October. Can you believe that? Wow, wow, wow. Well, guys, welcome. Tonight we are excited because we're going to be talking about diabetic neuropathy. One of the triopathies. When we talk about diabetes, there are three things that everybody kind of knows about. So retinopathy, problems with the eyes; neuropathy, problems with nerves and peripheral and the periphery; and then, of course, nephropathy, problems with the kidneys. And so tonight we're going to be talking about one of those, that is neuropathy. If you are new to the channel, I'm Dr. Dwain Woode. That's Wood with an E, and the E stands for endocrinology. And we create content that help you understand the body, help you take charge of your lives, take charge of your health, avoid complications, and live healthy, fulfilling lives. Welcome, welcome, welcome. Some housekeeping notes. If you are new and you want to ask a question, go ahead and put a Q in front of the question, and we will get to those as we go through our program tonight. So that's right, a Q in front of the question. And our question tonight, the first question, and I want you to put it in the chat: do you know someone that has neuropathy? Right? And do you know someone that has diabetic neuropathy? Right? So put those in the chat. So yes or no. Do you know someone that has neuropathy? And do you know someone who has diabetic neuropathy? Let's see who's here. We've got Maria. Hey Maria, let's put that up. Let's see. Maria says hello. And EJ Fernandez from Tyrosine is with us tonight. Hey EJ, welcome, welcome. Let's see. There he is. He just says, "Hi, Dr. Wood. Thank you for the invitation. This is an exciting topic." It is, EJ. We are, we're going to talk a little bit more about that. Let's see. Hey, Monica. What's up? Monica's one of our regulars. We're always excited when she comes. And she has some very interesting questions, so we'll see what she has for us tonight. Well, welcome, guys. And so if you are on, go ahead and share this with people who may be out there who may not be on right now. Go ahead, and if you're on, give us a thumbs up for this video, and share it, and we'll talk a little bit more about that as we get into the program. All right, so diabetic neuropathy. So we talk about diabetes, and there are 34.2 million people in the United States alone that live with diabetes. Around the world, there are between 400 and 600 million people that live with diabetes. So a lot of people, right? And it is a very devastating disease because it can affect everything. We talk about the triopathies, right? Retinopathy, nephropathy, and neuropathy, but all of the body is awash in high blood sugar. So it's not just the nerves, and it's not just those three areas, but those are the common ones that we talk about. The statistics, if you look at a lot of studies, about 50% of people that have diabetes, that live with diabetes, have neuropathy. Wow, that is huge, guys. And neuropathy, we'll talk a little bit more about this as we get into it. Neuropathy comes in lots of different forms. So diabetic neuropathy, so neuropathy. So let's break that word down. So neuro meaning nerves, and pathy meaning something wrong in the body. So pathology, that's where we get that word from. So putting those words together, so there is a problem with nerves. When we think about the nervous system, we can divide it into two distinct parts. The central nervous system, which includes the brain and the spinal cord, and then the peripheral nervous system, which includes all the nerves. So whenever you talk about nerve damage and neuropathy or pinched nerves, usually people are talking about the peripheral nervous system. Things that affect the central nervous system, of course, are things like Alzheimer's disease, Parkinson's disease, and so forth. Although they can also end up affecting the nerves. But those are the two parts. And in neuropathy, when we think about peripheral neuropathy, as we talk about diabetic neuropathy, what we're saying is that those nerves are not functioning properly. And they're not functioning properly because they're being damaged by high blood sugars. So that's the pathology. That's what's going on. So those nerves are getting damaged. And I tell people that those nerves are asleep. And sometimes, well, a lot of the times, those nerves are damaged to the point where, unfortunately, they don't come back. And so we're going to talk as we get into the night and get into the show about some of the symptoms that we find. We're going to field your questions. So once again, if you have a question, go ahead and put that in the chat. So let's see what we got. So we asked the question, do you know someone who has, Monica says, let's see, what did she say? She says, I miss you guys. Monica, you don't have to miss us. We keep telling you that. You do not have to miss us, okay? There are... Oh, Maria says, hi, Monica. Hey, Anthony. Anthony says, good evening, Dr. Woode. Yes, I have diabetic neuropathy. Wow, yeah. So, and that's the other thing. Do you know someone? Or it could be yourself. So there you go. Monica says, hey, Maria. Hey, Anthony. And then Monica just jumped right in there with some questions. So, yeah. All right. So if you know someone who has neuropathy, go ahead and put it. For those of you who may be watching us who do not have like a YouTube account, go ahead and create an account, right? So you can ask us questions, you can interact with us, but you can also send us an email or send us a message, a question in our email. Dr. Dwain Woode, let me pop that up here real quick. Dr. Dwain Woode at gmail.com. You can also catch us at all of our social media platforms, LinkedIn, TikTok. We'll talk more about that as we get into the show. Of course, YouTube, Twitter, and then buy me a coffee. All right. Okay. So let's go ahead and let's just grab a question. How about that? Let's start. So how about this question here? I think I just got rid of a question. All right. Let's grab this one. There we go. So we go directly to treatment. So why don't I hold on to this question here, right? This is one that someone submitted. Why don't I hold on to this question? And maybe grab another one that before we'll get into treatment here in a minute. Okay. So let's see. How about this guy? Oh yeah. So what are the symptoms of diabetic neuropathy? Okay. So very good question, by the way. All right. Very good question. And as we talk about neuropathy, as I said, there are two parts to the nervous system. There's the central nervous system and there is the peripheral nervous system. And the peripheral nervous system is where nerves are running from, say, the spinal cord, right? So they've come from the brain into the spinal cord, and now they're running from the spinal cord into other parts of the body. And most notably, they are running into the fingers, the hands, the feet, the toes. And as those nerves become damaged, a lot of things that they do become an issue. So like what? Well, sensation, right? So the sensation of touch, the sensation of pain, of balance, proprioception, where you are in space, right? So when you close your eyes and you stand up, right, your body is trying to figure out where you are in space. And that's why we don't fall, because the nervous system is helping us stay balanced. So if the nerves are damaged, right, and they're not sending the right signal to the brain, when you close your eyes, you don't have the cues that you normally would have to tell you where you are in space. And so people can have problems with balance, right? Because the nerves are sending abnormal signals back to the brain, whether it's touch, so you can have pain, People can have burning sensation. They can have a pinprick sensation, like someone is actually sticking a pin in their extremities and their fingers and their toes. You can have so burning, tingling. You can have numbness, right? So that when something actually touches you, you don't actually feel that. Either you don't feel it at all, or you feel it and it's just light, right? So something is touching your hand or your toes or your feet very hard, and you just feel it like a light touch, okay? So those are all things that we see when we talk about diabetic neuropathy. So that's a very good one. Let's see. See what blood sugar. So here's one. Let's pop this one up here really quick. This is from Monica. And Monica said, if the blood sugars are controlled, can we reverse the neuropathy? Wow. Monica, you jumping right in there, aren't you? But very good, right? Because we talk to people about controlling their blood sugars and how that affects their entire body. Here is part of, and I'm going to answer this in two ways, right? So when a nerve is damaged, when we talk about neuropathy, most of the time, the damage cannot be reversed. And the damage can't be reversed in the sense that those nerves tend not to grow back in the same way, okay? And nerves grow at a very, very slow rate, okay? And so if you have neuropathy that's going from your toe, and neuropathy actually occurs from the extremity back, right? So it goes from the tip of the finger back into the rest of the body. So it starts at the finger or starts at the toes and it goes up, right? So if the nerve has been damaged coming down, it takes a long time for that nerve to even regrow. And a lot of times we say that no, we cannot reverse the neuropathy. And so the best, what did I say? The best thing that you can do for diabetic neuropathy is actually to control blood sugars so we can decrease the damage, that we can halt, if you will, the damage that's occurring. Okay, very good question. I love it. And that's the same question here that Anthony is asking, is diabetic neuropathy reversible? And the short answer, the simple answer is no, it cannot be reversed. We can treat symptoms of neuropathy, okay? We can treat symptoms of neuropathy. Now, having said that, there are a lot of places, a lot of studies, a lot of things that you will see online, things that you will hear people say, where they say they can reverse neuropathy. And a lot of times what they're talking about is they can ease the symptoms of neuropathy. And we'll talk, we'll get into that here in just a little bit. Okay. All right. Let's see who's here. So Jeanette, good evening. How are you? Welcome. Welcome. Let's see. Jeanette says, hi, Maria. Good to see you. Good to see you online. Jeanette is one of our regulars. And she says, hi, Dr. Woode. I love it. All right, let's see. Let's grab another question. And let's see what we have here. All right, let's see. There we go. Let's see what this one says. Can metformin cause B12 deficiency, and can this lead to neuropathy? Wow, you guys are just on it. I love that question. So let's talk a little bit about B12. So B12 is a vitamin, and B12 itself, a lot of times when we are evaluating people for neuropathy, for instance, if you go to a neurologist, or even if you're seeing your regular doctor, a lot of times they will check your B12, because having a B12 deficiency can cause symptoms that are like neuropathy, right? Or neuropathy, let's just say that. So B12 itself can cause neuropathy. Metformin, for some reason, and we're not sure what that is, we think it's an absorption problem. There has been an association with metformin in people who are being treated with metformin with low B12 levels. So to answer the question, that B12 seems to be able to decrease the absorption. Sorry, not B12. Metformin seems to be able to decrease the absorption of B12. And so that causes a B12 deficiency. And because B12 deficiency itself can cause neuropathy, then that's the link, right? So B12 is deficient in patients who are on metformin in some patients, and that ultimately can lead to neuropathy. Now, there is no plan at this point that we put everyone that's on metformin on B12, because it doesn't cause it in every patient that's being treated with metformin, right? So there's no recommendation that we do that. But if we find someone who is B12 deficient, then we go ahead and we treat that. Okay, so that's a very good question. So B12 deficient with metformin because of, we think, absorption problems, and then because B12 a deficiency can cause neuropathy, then yes, we see a neuropathy associated with it. Very good. So here's a good question. Let's grab this one. This one is from Maria. She says, can arthritis cause neuropathy? Can arthritis cause neuropathy? And so can arthritis cause neuropathy? And the answer is yes. So one of the questions that this question seems to imply, and I'm going to just put it out there, right? Is diabetes the only cause of neuropathy? Well, the title of our show tonight is Diabetic Neuropathy, right? So that would stand to reason that if there's diabetic neuropathy, there are probably other things that can also cause neuropathy. So before we get to the arthritis and talking about that, so neuropathy simply means that there is some problem with the nerves, right? They're not functioning normally. So that's all neuropathy means. And so there are a lot of things that can cause the nerves not to function properly. Diabetes, of course, is the most common cause, but there are other things that can cause it. Certain medications can cause it. Patients who are on chemotherapy, some of the chemotherapy medications will cause neuropathy. People can have, like we talked about a minute ago, vitamin deficiencies that can cause neuropathy. Some infections can cause neuropathy. As we age, right, we all have some type of damage to some of our nerves, and so that can cause neuropathy. There are some neuropathies that run in families, right? So there can be a hereditary neuropathy. So there's so many different, there can be, for instance, lead, right? So heavy metals, those can cause neuropathies as well. So it's not just a diabetic problem, but there's so many different things that can cause neuropathy, diabetes being the most common. And so that's why we're spending time here. Now, here's an interesting thing. When they studied diabetes and they studied neuropathy, we have shown that if we have good blood sugar control, we can decrease the progression to, right, and the extent to which people have neuropathy. So the best treatment for patients who have diabetes is to maintain good blood sugar, good glycemic control. So that's why we harp on people and say, hey, let's get those blood sugars under control. Because if we can do that, then we can decrease the progression to neuropathy. And if you have neuropathy, we can decrease the worsening of neuropathy if we have good blood sugars. Okay, good. So let's see. So EJ Fernandez, let's see, what do we say here? Wow, EJ, that's a big question. What can I use to relieve pain from painful diabetic neuropathy aside from oral analgesics? Can topical NSAIDs or topical analgesics with less systemic exposure help? Woo! Well, EJ, I got to sit up so I can get my head over that. Very good question. So let's jump to treatment. Okay, so we just talked about the prevention or decreasing the progression to and decreasing the worsening. All right, so that's the first thing. Get blood sugar control. Get and maintain good glycemic control. There are so many different things that we have that are systemic. And I think I saw a question there, and we talked about gabapentin, and so we'll run back to that in a minute. But let me answer this one. So when we talk about things that have systemic, and what he's mentioning there is when you take something orally, right, it goes into the entire body. And so that's the idea of systemic. There are topical things that you can do. As a matter of fact, there are some things over the counter, right? You can get lidocaine patches, right? You can get some topical compounding things like naloxone or naltrexone. Those can help to relieve neuropathic pain. One of the big things that we don't talk a lot about is we don't talk a lot about physical therapy. That's right. Physical therapy has been shown to improve neuropathic symptoms, right? Exercise is one, right, that can also help with neuropathic symptoms. And there's a place here in town that we send a lot of our patients to that uses thermal treatment, so hot and cold, right? And so they believe that when they stimulate the vasculature, that can help as well, and it has been proven to do that. There are things that you will see people are using sound waves. Now let me show you something here real quick. Let's see if I can pick it up. Right, and so I am not right. I don't have any stock in this, but right below my desk, I don't know if you guys can see this, right? This is one of those, let me see if I can turn it on. Is it plugged in? I don't even know if it's plugged in. No, it's not plugged in. I'm gonna get somebody here in a minute. But this is a massager, a foot massager. And so for me, when I am sitting at my desk and I have neuropathy, I use the foot massager to help with that. It's almost like it diverts my mind from the pain, right? And so a lot of times, if I've had one of those days where my feet are particularly painful, then I will come in here, or sometimes I even take it in our bedroom, and I'll put my feet on there for 5 minutes. And it has one of these heat settings as well, and so that helps. So I hope that helps EJ with that question. Let's see, I'm gonna go back to, I think we had a question earlier. All right, yeah, so this is the one. So I have diabetic neuropathy. Is gabapentin safe to take? Is gabapentin safe to take? And so when we talk about medical prescription treatment for neuropathy, there are a few things that will be used. So gabapentin is one of them. A lot of places, the neurologists, they'll use Lyrica. Cymbalta is also another one that they use. And so all of these medications work. All of the medications, they work. Now, all of them may not work for everybody, right? Just like physical therapy doesn't work for everybody, or massage therapy doesn't work for everybody, or acupuncture doesn't work for everybody. And so finding a physician that will personalize, if you will, your treatment for the neuropathy is where you want to be, because maybe gabapentin is not the right one. Then maybe Lyrica is the right one for you, or Cymbalta, or a combination. Maybe some lidocaine patches plus Cymbalta, or as EJ said, maybe some NSAIDs, right? Those may be the things that we want to use. And so in terms of gabapentin is a safe drug that we use for the treatment of not just neuropathic pain, but we use it for some other treatments as well. So it is a safe drug. Always, I say, make sure that you are talking to your healthcare provider about the use of any medication, about the symptoms that you may have associated with those medications, and whether it's working. Now, guys, let me say this, right? And I'm gonna lean in a little bit, because I want to tell you, as a physician, I love when I can help someone improve their lives, right? One of the reasons that we do this show, one of the reasons that we do the things that we do is to help you take control of your life, of your health, so that you can live healthy, fulfilling lives, avoid complications. You remember that at the front, at the top of the hour, I said that? Well, how do you do that? You do that by letting me and letting your provider know what's going on, because we are treating based on what you're telling us, right? So if you're on gabapentin and it's really not doing what you need, let your folks know, right? Because we want to make sure that we are doing what we need to help with that. Okay, so let's pause for a minute. And let me pop this up. So once again, guys, if you've not already done so, go ahead and hit our subscribe button. You can find us on all of our social media platforms, LinkedIn, TikTok. Now, on TikTok, we are doing some interesting things there. So make sure you do that. If you want to see me try to dance, do a little move, we did one a couple of weeks ago. Maria is still trying to get me to do some weather dances. Now, here's what I said last week. I said, if you found a TikTok and you want me to try it, you were supposed to send that to us before tonight's show, and I've not gotten any. So I've got a reprieve, right? But I'm gonna put that out there again. If you find one between now and the next show that we do, I'm gonna try it. I'm not guaranteeing it's gonna be the next time, but I'm gonna try it. Also on obviously YouTube, Twitter, and then buymeacoffee.com/Dr. Dwain Woode. And then, let me see, let me pop this up. And so this tells you our schedule for the week, right? So our live show is Monday nights at 7 p.m. Our TikTok comes out every Friday at 10 a.m. And then every day at 9 a.m. we have a Twitter, something that comes out on Twitter. And that's usually some inspirational thought. There are some recipes that we'll put out there. We'll talk about just general health, right? So dealing with stress, getting good sleep. So all those things are out there. And coming up, right? So, let me pop this one up first. So we next week are going to be away. So next Monday night, we're not going to have a show. Me and my family are going to be away, and I may show you some pictures when we come back. But when we get back, right, on the 11th, we're going to be talking about managing stress. And October is Breast Cancer Month. And we're going to be talking with Curtis and Paula Akins, and we're talking about surviving breast cancer. So Paula is going to be telling us her story about surviving breast cancer, and we'll be fielding your questions, okay? So make sure that you put that on your calendar. If you know someone that has survived breast cancer, has questions about breast cancer, make sure that they are on for that. It is going to be a wonderful night to hear that story. All right, so let's see. So Maria, thank you for putting all that information in there. All right, so let's see what we've got here. Let's grab another question. And I think I answered this one a little bit, but I'm going to pop it back up so we could spend some more time maybe talking. All right, so does exercise help with neuropathy? Does exercise help with neuropathy? You know, guys, there are, does exercise help with neuropathy? There are so many things that we are learning about the human body. That's right, we're still learning. There are so many things that we don't know. There are some things that we do know, however. And exercise, in most cases, will help to improve not just neuropathy, but a lot of other illnesses. We tell patients who are diabetic that they should exercise, right? The cardiologist tells folks that they should exercise. If you have high cholesterol, if you're overweight, we tell you to exercise. If you are suffering from things like fibromyalgia, right? The treatment of choice is to exercise. So along with that, yes, for peripheral neuropathy or diabetic neuropathy, exercise does help. And that is why physical therapy also helps, right? Because they give you those exercises that are particular to what you're doing, so that you don't hurt yourself. So very, very good question. Let's see. So here's a good one. So what can I do? What can I do about tingling, numbness, or burning? And really, those are the main types of things that you see, right? Numbness, tingling, and burning. And for the treatment of those, once again, as we said before, we a lot of times cannot reverse it. We can't reverse the damage, but we can treat the symptoms, right? So the numbness part of it is the one part of neuropathy that is difficult to, I don't want to say treat, but it's hard to get feeling back, right? It's hard to get feeling back. The tingling and burning, those medications, as we mentioned earlier, right? So gabapentin, Lyrica, Cymbalta, they help with that. Some of the topical analgesia, as like EJ mentioned or asked about earlier, those things can help with those symptoms. The numbness, though, that's sometimes one that is most difficult to deal with. Now, let's talk, since we're coming up to this question, let's talk a little bit about how diabetes or diabetic neuropathy is evaluated. And really, this can go to neuropathy in general, right? So whenever we're finding someone who has diabetes and we're evaluating them for neuropathy, we begin by checking things like sensation in the feet, begin by checking vibration in the feet, begin by looking at their foot, looking at the hair distribution, right? All those types of things. And for people who are at home, we want to make sure that you are not walking around the house. What am I going to say? Without some shoes on. That's right. Right? That you're not walking around without shoes on. Because, as we said, about 50% of all patients who have diabetes will have some neuropathy. And one of the things that they sometimes don't have is great sensation. So you can imagine walking around your house without any shoes and you step on something, and that can cause damage to the foot, damage to the skin. Once that happens, then bacteria gets in there, and that can predispose to an ulcer, and then we get into some of the other complications that we will see with the feet. Okay, so guys, please make sure that you are not walking around your house without some shoes. Okay, that's the first thing. Make sure that you are looking at your feet. And I'm going to give a little description a little later, but make sure that you are looking at your feet every day, right? So those are the things that we want to do in terms of managing the symptoms. All right. So let's take a look. I've been I've been talking. Let's see what do we got here. Maria said, "Let's make Dr. Woode dance again." Hey, I'm gonna take that one down, Maria. No, I'm gonna leave it up. And let's see. Thank you for. Oh yeah, okay. So that's our TikTok. All right. So guys, head over there and take a look. Let's see. Okay, here's a good one. Let's pop this one up. This is by Anthony. Anthony says, "Can neuropathy cause skeletal muscular problems, back pain, leg pain, etc.?" Wow. Anthony, very, very good question, right? So we're talking about whether neuropathy can cause skeletal, muscular problems, pain in the back, legs, and so forth. Yeah. So the nerves that we have, when we talked about the central nervous system, the peripheral nervous system, well, part of where the nerves that are in the peripheral nervous system goes, they go to muscles. Right? So they go to muscles. So you can imagine that if the nerve that goes to a particular muscle is not working well, then you can have muscle weakness, right? So muscle weakness that occurs because the nerve is not sending the right signal. When that muscle becomes weak, then that muscle still has to support whatever function it was supposed to, right? So if it's a calf muscle, it still has to support the rest of the body. And because it's weak, it can begin developing pain. Now, one of the interesting things about the body and how, and we're so adaptable, guys, right? The body is an amazing, amazing system, because if you think about the fact that if you have a problem on one side of the body, what begins happening? Well, you start favoring the other side, right? So you start like, well, okay, let me see how I'm going to put myself in, right? So you start trying to move and position yourself so that you don't have pain. That in itself causes a problem for the other muscles. And one of the big places, so your waist, your hips are a huge part of keeping balance. And so if you start favoring one side, right, what begins happening is that you're in an abnormal position. And now we start to develop back pain, lower extremity pain, ankle pain. And so the answer is yes, that it can cause musculoskeletal problems, and it can lead to back pain in patients who may be positioning themselves inappropriately. One of the interesting things, we talked a little bit about that a minute ago, is that your body is good at sensing where you are, right? So body's good at sensing where you are. And so if you're not able to do that, right, most of us, if we don't have neuropathy or so forth, our hearing, our vision, and just our sense of space, right, proprioception, is what keeps us without falling over. And so all those things could become damaged, and patients can have issues there as well. Okay. All right. So let's see. So thanks for that question, Anthony. Chris Bird, let's see. What alternative treatments or therapies are there for the pain, right? Alternative therapies and treatment for the pain. So alternative treatment and therapy for diabetic neuropathy, neuropathic pain. And so we mentioned, of course, the prescription medications. Acupuncture has been shown to help. Heat or cold, those things that we talked about. We mentioned physical therapy. There's a practice here in town that does that. Sound sensation, right? Massage therapy. Just soaking, right? So all those things have been shown to be of help. Of course, there is, and let's get into alternative therapy. So one of the things that I've used in the past are things like CBD, right? So that has been shown to help with neuropathy as well. So there are lots of things that are out there that can minimize or decrease what people are experiencing. And once again, make sure you are talking to your healthcare provider. I cannot stress that enough, guys, because we can only do for you if we know what's going on, right? So find your healthcare provider, talk to them, let them know what's going on, so that we can try to get you better help. Okay, and I didn't get to say, sorry, Chris Brown, I'm gonna put your question back up just so I can say, welcome, welcome tonight, all right? And guys, yeah, if you are new, go ahead and put new in the comments, So welcome to you, Chris Burt, awesome. Let's see, here's a question from Jeanette, and Jeanette, let's see, what do we have? I have numbness and cramps in my fingers. My doctor said it's arthritis, but did not give me medication. What can I do to help myself? So very good question about arthritis and pain. So there, once again, there's so many things, guys. And let me back up before I answer that question and say that when I began asking people about pain, right? Because, traditionally that's something that we do see that people are living with, and a lot of people don't say it, right? So they have a little pain here, a little pain there. But when we started actively asking people about pain, and one of the questions I do, when patients are in, almost every patient that comes through our practice, when I'm in the room, I ask them, are you having any numbness, tingling, burning? Are you having any swelling in your lower extremities, right? How are you sleeping? What's your energy like, right? So are you able to do most things through the day that you want to do? So all those questions. And with pain, we're amazed at how many people have some kind of pain and who are living with it, right? Because you get used to it. And you say, oh, yeah, my foot hurts all the time and this is what I do. So in terms of arthritic pain, it once again depends on the person. I would first check with your family physicians. As I mentioned before, the things that we do for neuropathic pain also can help with things like arthritic pain. But stretching, right? Making sure that you're stretching, making sure that you're using heat or cold, particularly for our patients who have those joint pain. And once again, the joint issue that we're seeing, a lot of times, it's the inflammation in the joint that's causing the pain. I mean, I know there is a physical thing that's going on, whether it's bone on bone, whether it's a stretched ligament, whether it's the fact that the muscles are not able to support you anymore. And one of the things that the physical therapist will do when you go in, right, particularly if you've got a joint problem, is they will try to strengthen the muscles around that joint, right? Because if we can get those muscles to work properly, to be stronger, then sometimes the pain in the joint can be minimized or sometimes alleviated. So very good question, Jeanette. I love that one. Oh, hey Soul, how are you doing, man? Welcome. Good to see you. Awesome. Good to see you guys. All right, let's see. What else do we have? Let me take that one off. And let's hop over here and see if we have another question. So here's a good one. Let's see. That's number 9. All right. It says, my arms and legs have pins and needles. Should I be worried? My arms and legs have pins and needles. Should I be worried? And so, as we mentioned before, diabetes is the most common cause of neuropathy, but it is not the only cause of neuropathy. There's also, so there are a lot of things that can cause it, right? So we went through several of those. B12 deficiency, so vitamin deficiencies. We can have medication that's causing it. Age can cause it, right? So as we age, the nerves sometimes will get some damage. It can be genetic, right? So it runs in families. There can be also something called radiculopathy, and radiculopathy just means a pinched nerve, right? And that pinched nerve has a lot of the symptoms of diabetic neuropathy, or neuropathy, I guess, let me say it, right? So it does not necessarily have to be neuropathy. And should you be worried, I would say make sure that you are talking to your healthcare provider, right? That's the big thing. Make sure you're talking to your healthcare provider, and they can help you with a lot of what you may be experiencing, okay? All right, and so guys, as we, going through the shows, one of the things that we want to do is not just are we talking about the physical body, but we also talk about the mental health, and we also talk about other things that we can do to take charge of our health and take charge of our lives. And today I want to talk a little bit about organization. That is organization, particularly as it relates to our time. Because we see so many people that come into the office and we talk to them about whether it's diabetes or their weight or their cholesterol or other disease processes that they have, and say they're not doing the right thing. And I said, well, how come? They said, well, I'm just so busy. I don't have time for that. And I want to say to you, if you think about your life, the most valuable thing that you own is your time. If you don't use your time today well, say tomorrow comes, you can't go back and say, hey, wait a minute, I didn't do a good job yesterday. Can I have that time back? Because guess what? That time is gone, right? So making the most of the time that we have now is the best thing that we can do. And so organizing our time is huge. In my phone, and it's amazing how this little device, right, can help. So I've gone through and I've set alarms, right? So I got an alarm to get up in the morning. I talk to my assistant in the morning before I get to work, and I set an alarm for that. And I have a team meeting in the morning. I set an alarm for that. I have an alarm that tells me it's 5 minutes to leave work so that I can leave work on time. I know. You're saying that, yeah, that Dr. Wood, that is too much. But what is your time worth? How can you maximize your time? You may not need to do what I do in terms of putting these alarms on, but I want you to spend some time thinking about all the things that you need to do, right? And how best you can organize that. So get a calendar, get on your phone, put those things in there. And I want you to begin prioritizing what you are doing in your day. Sometimes we let the urgent take the place of what is best. Notice what I said. Sometimes we let the urgent take the place of what is best. Because everything on my list, right? Everything on my list has to be done, right? Everything has to be done. But what is the best thing for me to do today? So that's my thought for you today. The most valuable thing that you own is your time. Take some time to get organized. And all the things that we're talking about will fall into place if you are organized. Now, that doesn't mean that, one day you're not going to forget something and run off and do this and right. That happens. That's life, right? And then you regroup. But try to see if you can put some things in place within the next day, within the next 2 days, that will take some time, that will help you organize. There are 1,440 minutes in a day. That's right, 1,440. And aside from sleeping, most of us give all of that time away to someone else. I want you to take some time for yourself, and the best way to do that is to get organized. All right. So in the chat, right, I want you to put, how do you organize yourself, right? Just drop it in there. How do you organize yourself? What do? Do you have a calendar? Do you do skywriting? Do you have somebody call you? Does your mom call you in the morning, right? Do you leave breadcrumbs on the ground? Do you tie a string around your finger? Whatever it is, I want you to go ahead and pop that in the chat so that we can see that. Okay? All right. And then let's see. Here's a good one. Let's see. Let's grab this one. That is number 8. All right, and it says, does a TENS unit really help? Does a TENS unit really help? All right, so TENS units. So a TENS unit is a device that basically what it does is it stimulates a nerve that takes the signal, or takes the mind away, if you will, from where the pain is. So there's a pain at one location, and the TENS unit is working over here, and it's sending a signal, and so the body does not realize that this pain is there, right? So basically shunts that pain away. And the answer is yes, they do work. They are very effective, right? They're very effective. Now, once again, they don't work for everybody, just like nothing that we've talked about tonight works for everybody, okay? But they do work. And always, 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 again, it is a matter of getting with your provider and talking with them about what the best treatment is for you. And guys, let me say this, right? So a lot of times you've got to try several things, right? So the first thing is not going to work. But don't give up. Don't say, okay, there's nothing that can help me, right? We keep trying until we find something that works the best, right? Is 100% of your pain going to be gone? Maybe not. But if we can take your pain from a 10 down to a 2, wow, that's amazing, isn't it? Right. So make sure that you are talking to your folks. So we've talked about a lot of things tonight. TENS units. We talked about medicine. We talked about some alternative treatment ideas. All of those things, they work, but they may not all work in a particular case. And so we want to make sure that we are finding the right thing for you. So let's see. Let's see, what do we got? So we got. So Soul said, I am not organized. So we got to get you organized, right? So that's our challenge. That's one of our challenges for you. Get organized, right? We want you to be organized, because when we're organized, there's so much that we can accomplish. Let's see. What does Chris Burt say? He says that everything I do it for you. Dance challenge. I didn't see. Let me take that. See, Chris Brett, I didn't read that before I put it up. I'm going to take that down. No. So he said, everything I do it for you. Maria, make note of that, please. Chris Brett said, I'm going to get you, Dr. Woode. All right. So you've laid down the challenge for us tonight. Okay. So we got to find something to do for that. All right. Now, so you want me to dance to it, right? Oh, wow. Okay. So not sing it. Not just do a talk with it in the background, but you actually want me to dance. Okay, all right. So we've got that there. Awesome. All right. And let's see. Talk about exercise, can Metformin. Must be told there's... Maria says, "Ooh, no." Hey, wait a minute. I can do that, Maria. I'm gonna have to. I might have to get some pointers, but we can do that. So let me. I'm gonna pop this one down. I need to do something here real quick, guys. Give me a minute. I think this is the one that I got rid of earlier. And let's see. And it actually is the one that, right, that starts the whole thing. Maria said, "Do it now." No. Oh, okay. So yeah. So what is diabetic neuropathy, right? So that's the beginning of what we said earlier. So let's go back. So diabetic neuropathy is one of the triopathies of diabetes, where the blood sugars damage the nerves. And because of that, we have things like burning, tingling, numbness, pain. We can have balance issues in terms of proprioception. So that causes so many different things in our body. And once again, guys, remember that it's not just the nerves or the kidneys or the eyes that are problems, because the entire body is awash with high blood sugars, and so everything is going on. Now, one thing that we didn't talk about, and no one asked the question for this, but let me jump in here and talk about some of the other things. Number one is something called gastroparesis. Right? So gastroparesis occurs because the nerves that go to the GI tract are damaged. And because of that, people will have symptoms, nausea, sometimes they'll have vomiting, they just feel a little queasy. And what happens a lot of time is that the food, as it goes through the GI tract, is not moving in the normal way. Either it's going through too fast, or it's not going through fast enough. So the GI tract, because remember, the motility of the GI tract is partially due to the muscles that are there, and there are also nerves that innervate the GI tract. And so gastroparesis is a GI complication of neuropathy. All right. So that's not one that we talk about a lot, but it is very, very debilitating to some people, because you can imagine always, you're eating and you're not sure, is it going to stay down? Is it going to come up? Am I going to feel nauseated? Sometimes you'll look at food and it doesn't, you can't imagine eating it. So the food does not look good to you. Your appetite goes away. So lots of different things that will happen there. The other one is erectile dysfunction, right? So remember, all of our anatomy is innervated with nerves. And so if the nerves are damaged, men can have erectile dysfunction. A lot of men, 30 to 60% in some cases of patients who have neuropathy, diabetic neuropathy, can have erectile dysfunction. And so once again, sometimes we cannot reverse, but we can certainly delay or diminish what we see in terms of neuropathy. So once again, it's not just the feet, it's not just the kidneys, it's not just the eyes, but everything is a wash in high blood sugars. Let's see. Hey, what's up, blind guy? Hey, man, welcome. So I've missed most of this, and I always enjoy your stream. Well, thank you so much. Hey, I caught one of your streams. Was it yesterday that you had a panel on? So good. Was happy to get on there. Interesting topic, by the way. Okay. All right. Let's see. What does Chris Bird say? He said that what Dr. Woode will do, Maria will do it too. I like that. Chris Bird. So I think if I do it, then we should get Maria to work with it again. And then let's see. EJ says, some diabetic neuropathy manifests as itchiness instead of pain. Do we use the same treatment for the unbearable itchiness? Now, that's an interesting one, EJ. You're right. So we don't talk about the itchiness that comes with diabetic neuropathy. And the itchiness that comes with it, it's not like the skin, right? It's deep. And so sometimes trying to do that is a problem. Sometimes I'll have some itchiness, and I once again will use the massager, right? The one that I held up earlier. I will use the massager to help with that. So you are right. And yes, all the same things that we do. Sometimes we'll have to use the analgesic. Sometimes we'll have to use that deep massage. Sometimes we'll have to use acupuncture. All of those same things can help with the itchiness. Very good. Thank you for pointing that out, EJ. And I'll have a challenge myself, because sometimes I become overwhelmed with the volume of tasks at hand. Oh, thank you, Yolanda, and welcome. Thank you for saying that, because you're right. Now, I'm going to tell on myself, okay? So in my room right now, there are baskets of clothes. And my wife asked me, she said, how can I help you with that? And I said to her, what I would love is to wake up one morning and to have all of my clothes laid out for me for the day. And she said, I can't help you with that. She said, I can't help you with that one. But yes, getting organized is so important, that it helps with a lot of the things that we do. Well, guys, we are so glad that you are here. Thank you for coming in. Make sure that you send this, like it, please like it, subscribe to our channel. We are so excited that you're here, that you're participating. Once again, if you're new, or even if you've been here, we create content to help you take charge of your health, to help you minimize your complications, and to help you understand your body and live a healthy, fulfilling life. All right. So thank you for coming. This is Dr. Dwain Woode from Diabetes and Endocrine Wellness Center and the Light Away, educating the public for a better you. And let's get some going away music.